Hey everybody, welcome to the Healthy Way Vibes for another fantastic show. We've got a great show today. We've got a regular guest, Dr. Theresa, and today, well, it's October. It's actually Breast Cancer Awareness Month, so this is perfect timing. Dr. Theresa is going to be coming on to talk about breast health. So, hi, I'm John.
Hi, I'm Cyrene. You know what, you guys, I might be muting myself throughout the show because my husband is working from home as well. We've got this noise thing going on.
That's
So I
okay.
apologize in advance.
Yeah, home office, home office. So before we bring Dr. Theresa on, I'd like to share a little bit about her and a little bit about her experience and so forth. So Dr. Theresa, she's a certified functional medicine chiropractic physician. His life purpose is to help her patients solve health issues through balancing their biochemistry with natural compounds using herbs, vitamins, minerals, neurotransmitters, bioidentical hormones, chelators, binders, phytonutrients, and many more. So she uses a whole wide range of things to help with her patients. So she focuses on advanced testing procedures and extensive history to create effective treatment plans for them. And she was actually a research scientist at a pharmaceutical company, and she has also dealt with her own significant health challenges that only improves through natural means. She has two beautiful young women daughters, the owner and director of Health Up Institute since 2011, and she's an active lecturer, educator on many health topics, and an international speaker on iodine therapy, which we'll touch on today, and its vital role in our overall health and healing. Besides her chiropractic doctorate degree, she has a Bachelor of Science in Chemistry and a Master's of Science in Environmental and Industrial Health from the University of Michigan. And she's a lifelong learner with an open mind of combining science with energy medicine, and she's also been trained as a yoga instructor. So let's bring on Dr. Theresa. And also want to point out that, what we're going to be discussing today is just for information. We're not here to diagnose or give you advice to follow. Of course, if you are involved, if you are dealing with, someone that's going through breast health issues or cancer or anything like that, make sure you talk to their specialists, or be that support network there for them, and just make sure that you're educated as well. But again, we're just here to not give any medical advice or anything like that. Let's bring Dr. Peters on.
There we go.
There we go.
Welcome. Nice to see you.
So it's perfect timing again. It's October, Breast Cancer Awareness Month, and you can be talking about breast health. So it's a big issue, right? It's a big issue for I think 1 in 8 women are diagnosed. So how do people kind of take care of themselves first, and then if they find out maybe there are some concerns, or what is that process, and kind of what are the triggers, and what have you found in terms of treating some of your patients?
So that's a very loaded question, because in treating anybody with any cancer, especially even breast cancer, is, well, why did it happen in the first place? Looking at what is imbalanced in their body, what obviously affected the breast tissue, but if the breast tissue has a change and has cancer, there are other imbalances going on throughout the body, through their immune system, perhaps an excessive amount of certain chemicals or toxins or molds. They could have other hormonal imbalances, especially the thyroid, adrenals, and then your steroid hormones, which of course your estrogen, your progesterone, maybe the androgens, DHA and testosterone. The association with their thyroid is very significant, not only in the process of helping to treat if they were currently diagnosed with breast cancer, but to prevent further damage or problems to their thyroid, because there are many studies that once you have breast cancer, you have a very high likelihood of having thyroid cancer, and vice versa. And even having thyroid disorders, having breast disorders. So either of those disorders, thyroid disorders, maybe being inflammatory, autoimmune like Hashimoto's, or just hypothyroid or hyper or Graves' disease, or that's just a disorder, not cancer yet, but it's a precursor to a potential cancer. Same thing with the breasts. The breasts, they most likely had other issues long-term. Often women will have dense breasts. That's what they're told. It's like, oh, they have a mammogram and they can't see very well. That density should not be there. What is causing that density? And then they get fibrocystic breasts or painful breasts. They might have what's called lumpy breasts that aren't cancerous, but they have these odd lumps, which is a fibrous tissue. Why is that tissue not healthy and naturally remodeling? So I think it's important in understanding how to treat it. What is the breast tissue like and what's going on? And then, and to me, iodine is a very key aspect of helping to treat breast cancer. Now, as you guys know, there's different types of breast cancer. Of course, there's the staging of breast cancer. So the worst, getting into stage 3, stage 4, and affecting other areas of the body and lymphatics. Sometimes the best scenario is combining holistic natural treatments with some medical Western modalities. I'm not opposed to certain modalities that are needed. And I think it's best if we all work hand in hand. But we cannot neglect the fact that you also have to create the best cellular health for them, for their breast tissue, for their immune system, and the other effective tissues like their liver, their adrenals, their thyroid, other tissues. So the breast tissue itself, we have the mammary tissue, which is sitting on top of the chest. People think it's, infiltrated or connected. It's actually like its own separate tissue, and it's got its own, arteries and veins, its own vasculature, has its own nervous system, nerves going in there, and then its own lymphatic system. And the lymphatic system is what drains out toxins, mutated cells, whether they only have fibrocystic breast or they're diagnosed already with breast cancer. They have to ensure their lymphatic system is moving and clearing as best as possible. So that's why I really just have to make a small side comment on it, because the lymphatic system does not move on its own. We're familiar with it being around our body, our lymph nodes up over here. We've got lymph nodes in our arms and our legs and the spiral. The only way that flow edges up toward or down toward the liver, where everything, what's going to dump into actually these, the venous system, and it's going to be taken to the liver. But to get to where it needs to go, you have to have a muscle contraction. With the mammary tissue, there's no muscle there at all. It's tissue sitting on top of muscle. So if there is not some type of movement, hence, why, fitness is so important, why exercise is important. It's an important part of even breast cancer healing. Now, of course, nothing, crazy jumping, running. They might just need some very gentle movement. You have to have movement in the tissue around your breast. So one that can be through doing a rebounder, which I think is one of the best things people can do. Brisk walking, where you're actually moving your body, any type of yoga or just movements, lifting your arms up and around, gentle movement. You have to move this tissue in order for the lymphatics to move. And then, yes, you can manually move it. So once you're diagnosed with breast cancer, you do not do lymphatic massage. So this is preventative now when I'm talking about doing a lymphatic massage for your breast. There are all kinds of videos. I'm not going to go into detail about it, but look up breast lymphatic massage, and it's working through this tissue area to help move and clear toxins, spent estrogen and hormones, things that can, cause cellular change that we don't want. And then also just vibration, so tapping. People forget about gentle tapping. So you can tap as well. So that's just one key aspect of the breast and dealing with the lymphatic system. Then we want to address toxins in their body and how to get rid of those toxins. We'll do full evaluations, from a doctor's standpoint, running various tests, urine tests, blood tests, and then we do a 24-hour iodine test. So iodine itself is extremely critical for the breast tissue. It's extremely critical for the thyroid tissue. It's critical for any pretty much steroid hormone receptive tissue, which, for women, the breasts, the uterus, the ovaries, and then we also the salivary glands, the stomach, the liver, the brain. And then for men, we add in there the prostate gland. So knowing what the iodine levels are for that gland. So I can keep going on that. I know you guys might have had another question here, and I wanted to just check.
So actually, so when you talk about iodine seems to be of course your specialty in many areas, but especially in this topic as well. But when you talk about iodine, people are getting it from their foods, and they're taking it in external sources like vitamins or liquids or whatnot. Is there a difference in terms of how you get it, and maybe the potency, or even maybe is it better one way or the other?
Great question. We need to get iodine in many, many ways and many, many forms. So definitely getting it from our food is going to be highly absorbable. You're not going to overdose, taking that iodine. And I encourage people eating their iodine-rich foods, which would be your seafoods, your seaweeds, eggs, dairy, if you can handle dairy, organic grass-fed dairy, have it in there. So those various foods you can get that iodine from. However, that should be helping to, quote, balance a healthy body. And a healthy body would be one that is not also battling a complete sea of toxins that we live in and disruptors to iodine that we live in. There are direct disruptors, which are other halogens, bromides, and fluorides that can not allow iodine to attach to where it needs to, because they have a greater affinity for the receptor site for iodine. And also heavy metals can cause those problems too. So the fact that most people, and especially in the United States, and I grew up in the Midwest, which is called the goiter belt, very low in iodine, because it's nowhere near the sea. If you live by the sea, you're gonna have a little bit more iodine because you might eat more seafood. The soil's gonna get a little bit more iodine, but you're most likely going to have a significant iodine deficiency. Mm-hmm. So to replete the needed iodine, so you don't have cellular disruption, because iodine is key in regulating what's called apoptosis, programmed cell death, for normal and abnormal cells. Mm-hmm. Iodine is needed to make our thyroid hormone. It makes our T4, T3. It's the key part connected to a tyrosine molecule. Iodine is needed to help regulate our hormones, our steroid hormones. You have to have enough iodine saturation in your body. Now we're talking about breast health here. Your breasts have to have enough saturation of iodine in order for the estrogen to function properly in that tissue. Mm-hmm. And then all this talk about creating the right balance of estrogen to progesterone in our bodies, whether women are cycling during their menstrual cycles or post-menopause, you cannot maintain an estrogen balance without having normal levels of iodine in your body. Mm-hmm. And those normal levels, often to get there, food is not enough. We have to add in supplemental iodine, whether starting low at 1 milligram, 2 milligrams, literally up to a 50 milligram or more dose, depending on the situation. But when we talk about higher levels of iodine, there are consequences. And the consequences are often to get toxins out of the body. So you have to do a full evaluation of someone to determine how their overall systems can handle things. Other health issues that might need to be assessed. We always assess their thyroid before pounding in a bunch of iodine. We need to know what's going on. We need to know how their liver health is, their adrenal health. And if they already have breast cancer, there are many studies that are showing long-term deficiency in iodine. And there are actually studies done on rats in this, how that will create a fibrocystic breast situation. And then by giving iodine, it corrects itself. And then even, case study by case study, there's thousands of them by other iodine doctors and hundreds by myself with breast issues, uterine fibroids, endometriosis, PCOS, doing it correctly, balancing their body system while bringing up a higher level of iodine with the appropriate other nutrients helps resolve a lot of these issues. It's amazing.
So what are the signs of having breast cancer? What should we be looking for?
So one, sadly, sometimes people don't have any signs. I think it's up to like 40% are completely asymptomatic when they're diagnosed. They might have found it through their preventative screening. So I think that's one of the first things to just comment on. One, doing your self-exams. They'll say, oh, once a month women should do a self-exam. If you're doing it once a month, I know people who never ever do it. So getting them to do it once a month is a big deal. And if you're cycling, it's around day 5 to day 7 is ideal to really feel your breast tissue and make sure there's nothing odd, no lumps, bumps, or uncomfortable areas. And if you're in menopause, it could be any day of the week. It doesn't matter, any day of the month. But we actually, because the breast changes throughout the month, it's a good idea to feel throughout your own cycle. If you're cycling, how do those things feel and change? So one of the first signs is a change. Noticing some type of change, a new lump or bump or thickness or discomfort, that's your yellow flag. You need to get it checked out. So that's one of the first signs, and then getting annual screenings when you get older. And mammograms is its own animal, and it does have a radiation risk. And I actually believe it may have its place, but it's one of the last resorts. Thermography, which is a screening of heat change in the body, can see vascular heat changes in an area, which if there's more vasculature coming there, something's growing. There shouldn't be extra heat in a certain spot. It can detect something 10 years before something would show up on a mammogram. So wouldn't you want to be like a big heads up, something strange is going on? Maybe we need to look at our hormone balance, our estrogen to progesterone ratio. What's our thyroid doing? What are our iodine levels? What about other trace nutrients? Maybe they've got other toxins. We can look for toxin loads and mold exposures in their body. So screening, and then ultrasound, doing an automated 3D breast ultrasound is also a great screening tool. Thermography, you can start having those done, I would say after puberty is all over, 18, 20, start getting some healthy baselines when your breasts are healthy, so you have a good comparison for what you're going on. But if you've never had it, you can start at any time. Same thing with the ultrasound. Screenings would be earlier if there is breast cancer in your family. So that's the other sign. It's just kind of seeing what's going there. Now, visually, looking at your breasts in a mirror, women need to know what they look like. And if they start seeing any type of weird dimpling anywhere, on the side, on the front, something unusual, that could be a cancer inside. Think of something growing and kind of pulling in on that tissue. There's something called, can't think of the name. It looks like orange, an orange peel. We call it orange peel look, where it's multiple dimplings. That's another sign. Any warmth, red, hot areas, that looks strange. The actual nipple turning inward, because that's ducts. That's the duct, the milk ducts coming out. Something could be inside pulling on the milk duct, like the strings in there, the ducts. And so if you notice any changes, in the nipple area, those are all signs, man. Go get a professional assessment done, screening done, an MRI done, ultrasound done, and determine what are the next steps. What are the treatment steps, biopsy, etc. In those cases, I think it's best to work with a team. Maybe there's a medical aspect because it's good to get it diagnosed. What is it? Maybe they need a biopsy. Maybe it's dangerous. Maybe it's not. Maybe it is. It's called, a HER2 positive, an estrogen positive, or progesterone positive. What type of cancer is it? How far imaging can tell us how far it's spread. All those can help guide the intensity of the different treatments. Mm-hmm. So I personally would like to work on a more natural level, removing the toxins, maybe again hitting it at a higher dose of iodine, hence you can't get that from your food. You therapeutically need to work with someone who understands what's happening to bring in higher levels progressively while we're assessing what's going on in the body. And that may or may not be needed to complement a medical treatment.
What are the chances of men getting breast cancer?
They do get breast cancer. It's much, much lower. I can't even think of the percentage off the top of my head. I think in our talk last year, we did bring that up, and I've been just so embedded in my iodine research lately. I've completely not even done statistics. But yes, men can get it. It's a lot less likely. However, because of things like our xenoestrogen in our environment, coming from plastics, from fertilizers, from other chemicals, can create a more estrogen environment in a man. And they have mammary tissue. I mean, much less, it's smaller, but that can create it to grow. So, when you see those man boobs, that's not a good sign. One, being overweight, yes, you could have just excess fat. Maybe your mammary gland didn't grow at all, which would be ideal, and they just have some fat there and maybe losing weight's going to help it. But often when a man notices any type of growth in that area, some of it's fat, but there could be breast tissue changes, and it can be from the other estrogens in their environment causing that. If they have pain, discomfort, things look red, hot, weird, the same type of changes, even a man's nipple going inward, that's a bad sign. Go see your doctor right away.
Right, right. So it sounds like, prevention is key. We're always talking about prevention and, just living a more positive, healthier lifestyle with some, choices that can help that journey. And then, you covered some areas on how to prevention in terms of screening, and then also some different avenues of treatment, or at least care while someone's going through this, or if they're diagnosed with it. But how about if you're a family member, or like, so let's say their network, their community, if you know someone going through this, I mean, sometimes that is just as important, to have that support. How do you kind of guide some of those, people outside the home on how they can help someone that may be going through some challenging times?
It's so important, in all our interactions in life, for community and supporting each other, and getting any kind of cancer diagnosis, breast cancer being a very key one. You just need to address many avenues. One, how, do they just need you to be there to be a listening ear? Do they need help? Do they need help with their children? Do they need help with chores around their house? And a lot of these things, I know you know this, so I'm just talking kind of the social aspect first before the medical aspect, because we often want to tell people, oh, you should get chemo because they know someone who got chemo. You need to get radiation. Or they might come up with some alternative therapy that they try to push on them that may or may not be right. So it's very important to respect a person who is going through a difficult time, and like, we were talking before, if they need food, check what they need. Do they need chores done? Check with their family, but also being there for them and literally asking them, is there anything I can do for you? And then you can provide education. So, with us doing this, and you're aware of more natural things and how important micronutrients are, and how important the thyroid hormones are for breast cancer situations, how important liver detoxification is, and the key in this whole talk of how important iodine is for the breast tissue and other issues. And I think, depending on your relationship with them, having to sit down and say, hey, I know you're going through a lot, and I'm sure their head is spinning. They've been thrown with a lot of information from the medical doctors and some crazy diagnosis with letters and numbers, and a grading, and they don't know what's going on, and they're worried about what's next, and are they going to live, or whatever situation. But say, hey, if you'd like me to talk to you about some, natural ways that may complement your treatment, or you may want to look into this more, I would always, I try my best when I know anybody that's gone through it, to just ask them if I could talk to them about that. And then bring up iodine. Have you looked into this? Look into this research. There are multiple, books to look into. I always mention Dr. Brownstein's book, Iodine, Why You Need It, Why You Can't Live Without It. It's just a great basic book, but Iodine Crisis by Lynn Farrell is a very good book. There's, multiple, Dr. Deary, I'm trying to think, oh my God, I always have breast cancer. This is called, I can't see it, breast cancer and iodine, right? Dr. Deary, he's a Canadian doctor.
Right.
You guys in Canada, I know you guys are
Yay.
Yay, good for him. To at least even just provide educational materials for them. But yeah, be a listening ear and offer that there are other solutions if they're willing at that time, and don't give up. Because if it's in the beginning of their diagnosis, it could be panic and everything going in. But as you know, it can be a long road and a challenging road. And sometimes it's a year of treatment. They do certain things at once, and they got to wait a certain amount of time. Even in those in-between times, there's things that can be done. And if they choose to go through chemo and radiation, because perhaps that is necessary for the aggressiveness or whatever, you still need to address that. Causes other damage, causes damage to the brain, damage to the liver, other things that we want them to heal and repair. So after their cancer treatments, they have their most optimal health. And iodine is a key part of allowing their body to renormalize as well.
So I think it's important to, whatever that we've discussed, Dr. Theresa has shared is, bring it to your specialist. I mean, in conjunction with what you're going through or what treatments that are recommended, to say, hey, you know what, I was, good friend recommended this. Is this something that I can integrate? In the end, again, we're not here to diagnose or to say that this is what you need to do, but if you are going through this or know someone that's going through this, it's just to have a good wide range of options to explore, because sometimes, like you said, you get thrown into this and everyone's just kind of grabbing at anything to, I just want to fight this, want to get over this. And sometimes it's you got to kind of step back and have more things, like educate yourself while you're going through it, not just and so you have to work with your doctors and specialists and other healthcare providers to have a good plan, right?
Exactly. And that's the challenging situation, but as we really try to focus on is that prevention aspect and the warning signs. And fibrocystic breast is a warning sign. Breast pain is a warning sign. That doesn't mean you have breast cancer, like kind of we're talking about those other signs that you see, but those are known potential precursors and research precursors. So, regarding iodine, they have found taking like 2 to 3 milligrams of iodine, which is not that high. It's only a little bit over, 10 times over the RDA, but not that for a couple weeks is enough to help saturate the thyroid. However, the breasts need, the iodine and iodide as well. The breasts that, want the iodine, but it's a very, very slow process for the breast. And so higher amounts, like the 50 milligrams to 100 milligrams, may be needed to help correct that tissue faster than it's changing in the bad way. So this is another way I try to explain to people who only want to do a natural way to treat a cancer. Because I do believe cancers, can be treated naturally, all these things. But if cancers are mean and aggressive and they can destroy you very fast, and again, our body can only heal so fast. And we can make that healing process go a little bit faster naturally in different ways. But if whatever's going on is going, let's say, 10 times as fast as you could heal by like the amount of iodine that you're eating from your food, you're never going to catch up.
Right.
Maybe you decide to take, 12 milligrams of iodine, and this is still working at 10 times, creating fibrocystic breasts. And now, it's clearing it away at 5 times, but you're in a deficit. So it's kind of getting better. That's where those higher dose therapies come in. We need to fight it. Maybe with 50 milligrams is going to be the stopping point. But now we got to get it to heal. Fibrocystic breast can take 2 to 3 years to heal. People have a hard time understanding there's no one magic pill. This is time of boom, whatever's causing it, we got to stop it. We need to remove, like we mentioned earlier, what toxins are in their body that's inhibiting this imbalance of their estrogen and progesterone and whatever's going on, whether it's mold and heavy metals. Then we need the tissue to heal. So that might be even a higher dose than the stopping dose until things start flipping. And as you're getting more of a dose that, we don't want to do anything in excess, but now this is down, we lower it. And that's why we monitor. And I can't stress enough to my patients and other people, data. That's why you test. You do testing. You do the 24-hour urine test. I do not like guessing games. As a scientist, I want data. Sometimes you can't feel yourself. You're like, oh man, things, like if it's breasts, things are still hurting 6 months later. But we look at what the first set of data was compared to the second set of data, and you're like, wow, look at this. Look at the halogens that have come out of your body. Look at how your saturation has improved. But it hasn't gotten to where it needs to be, because if it gets to where it needs to be, it'll be gone. But you're going in the right direction. So data helps you see you're making progress when you can't feel much progress either. And the same goes for thyroid, for people who have uterine fibroids or endometriosis or PCOS or any prostate issue. It's doing the iodine therapy correctly. It's not just taking a bunch of iodine. You've got to take other nutrients with it. And you need to be monitored. If someone does not do that, because there's other practitioners, and that's great, you need to be monitored.
Well, thank you so much. That was a lot of information.
I know, that was amazing. But I
And
just want to
time-
ask one quick question.
Yeah.
When somebody comes to you and they're diagnosed with breast cancer, and automatically they all start thinking the negative, and how do you stop that? Because it's almost like, oh my gosh, am I going to die? Versus that comes up first. And then it's like, and then once your body calms down, it's like, how can I address it?
Right. How can I fight this?
Yeah, exactly.
We know the mind is amazing. And there's a wonderful movie called Heal that I always recommend my patients to watch, because it's the mind over matter. And it has to do with a lot of, your beliefs, your spirituality, and how the mind directs what the body does. But the body can get disrupted because of toxins. It all comes back to what is disrupting it. Heavy metals, molds, chemicals, environmental toxins. Because if our biochemistry was perfect, we didn't have any other issues going on. The body knows how to heal. It strives to get rid of bad things. The immune system knows what to do. So when someone's in that state, one, you've got to give them hope that the body is amazing. Miracles happen. Things change with combining what people call alternative medicine or natural way to treat things. I look at it as balancing the biochemistry. Get the toxins out, balance the biochemistry. And then maybe we need some other additional things to fight, but we have to heal. Even the fight causes damage. You got to heal the damage from the fight, even when the cancer might be stopped at that time. If the cancer came once, and that's why they have a 5-year survival rate, because cancer usually comes back if you don't address the underlying cause. So to save someone acutely, that's very aggressive, and that's where Western medicine shines in an acute situation. We want to save their life, but what caused it, and that there is hope. Many people beat the odds because they wholeheartedly and holistically look at, find out what's wrong, find the root cause, and address it from multiple angles.
Wonderful, wonderful. Well, thanks so much. We always learn so much when we have you on, Dr. Theresa. And so I hope everyone out there learned a little bit. And, if you are kind of in this situation, again, speaker specialist, and hopefully with what you heard today will give you a little bit of stuff to kind of build upon. Again, it's your arsenal that you're fighting with, right? And we want to be able to help you along with that. So, so tying on to the upcoming shows, we have on November the 3rd, we have Angie Romero returning, and she's going to be talking about your subconscious mind does not know the difference between past, present, and future. Then on November the 16th, we have Dr. Theresa on again with health optimization and 50th birthday, is it? So,
Hey!
birthday, we might have a little bit of celebration on that day, on the 16th.
Oh,
And then,
okay, everybody knows now.
Yeah, everybody knows. So
You don't look it.
no,
I was gonna say you're still in your 30s.
Yeah, you're doing whatever you're doing.
Exactly.
You got to share what you're doing. And then the day after, on November 17, we have Mark Gordon coming in with relationship matters and healthy communication. So that's super, super important as well. For relationships, it's all about communication as well. So thank you so much for tuning in, and we hope to see you again in November. But in the meantime, thanks for tuning in, and you can always follow us on Facebook, Instagram, and we have a blog and a website as well, the THWV.com. So thanks for tuning in, and we'll see you again soon. Thank you, Dr.
Bye.
Theresa.
Bye for now.
Bye.
Bye.